That's okay.
Good
Yeah.
morning. I am Donna Behite, and I am today with Krista Wasowski, and she is the Health Commissioner for Medina County. Good morning. How are you, Krista?
Good morning, Donna. How are you?
I'm good. I'm good. So,
Good. I'm glad we were able to have some time together. Yeah.
yes, me too. Me too. So Easter was good. It was quiet for you.
It was very quiet. It was very unusual to have an Easter like we had this year. So I'm sure that was the same for most of the people who are viewing this and watching you right now. So
Yes, I would
yeah.
agree with that. It was very, very quiet, I
Yeah.
think, for a lot of people this year. So there's a lot of people out there who are concerned. They're scared. They're worried about going out. What to stay home. And what is it that the health department is doing in Medina County? So if you could kind of walk us through, do you do the testing? I know you report the numbers, but on top of that, what services are you providing right now for the pandemic?
Yeah. So there's a lot in that question. So our primary role is to receive confirmed results from labs, physicians, and hospitals. We make contact with anyone who is a lab confirmed case. We work with them to identify any individuals that they were in contact with. From the time that they had symptoms, we look back 48 hours prior to their symptoms starting, and we talk with them to determine anyone that they were in contact with longer than 15 minutes in a close environment. So that's where I think there's a lot of questions from the public about, am I contact, am I not a contact? I know somebody who was a contact of someone. We have a very thorough investigation that we go through with our communicable disease nurses and the individual to determine where they were and who they were in contact with. They give us those names and contacts, and then we have a team that moves and talks with all of the contacts. So if someone receives a phone call from the health department, if you are a contact to a confirmed case, you go under a quarantine protocol. If you're in a lab confirmed case, you're under an isolation protocol. There's a different length of time. There's a different process that we follow, whether you're a lab confirmed, we call it an index case, or if you are someone who is a contact of an index case. So the contacts we monitor for 14 days to make sure that they stay healthy, or if they start to exhibit symptoms, then they would then be put into isolation. And the idea being, if we have somebody that's in quarantine, they're not circulating and in the public with people that they might be potentially exposing that 48 hours to they themselves having symptoms. So that's why we follow that process, and that's what we're doing across Ohio. So every health department is doing that exact same thing. And that's important to know, and it's important for people viewing this to know, because we do have folks that work and live in different communities across borders, and so it's important for people to understand that they might be being contacted maybe by Lorain Health Department or Summit or Cuyahoga or Wayne or Ashland, because they may have been in close contact through a work environment or somewhere else with an index case who lives somewhere else. But those are all, we coordinate among our departments, but we've kept it that way so that there's nobody missed in follow-up. So that's why someone here might be contacted or have a letter from another health department.
Gotcha. No, I didn't.
So that's our primary function with that. Yeah, for disease control. But then we also have to enforce stay-at-home orders, make rulings on essential, non-essential, follow up and work with the police for enforcement on that. We have an education role. We're working with hospitals on surge planning. There's a protective personal equipment shortage, which I'm sure everyone has heard about. And we're working with our partners over at Emergency Management to have all entities that are eligible to receive protective equipment to submit every week what their supply needs are. So we're working with them. They've really taken the ball with that. We have our partners, the Wadsworth Senior Center and the Medina Senior Center. They both, their directors are amazing women, and they, from the very, very beginning, our greatest concern at that point really was protecting our seniors, because we knew that they have more of the higher risk, they'll fall in that higher risk category. And they have done amazing work with making sure that seniors still feel connected and have food and are getting what they need in their households. We have a process in place if a spouse is positive in another, and their partner, their spouse is going to be put under quarantine. We've worked out a system to make sure they have what they need in their homes. So we're working all of that as well. There's just a lot happening in public health right now. So.
Yeah, and you're responsible for a lot of it, and that's, I'm sure that you guys had a lot of sleepless nights in the last few weeks.
We have, you know, we opened up our Health Department Operations Center on February 25th. So we have been full tilt working on this, putting everything we can into place, making sure that we have what we needed for the public since that date. And it's been a whirlwind, that's for sure. But, you know, that's why you have a health department. And that's why I believe Ohio is going to come out far better than a lot of the other states around us, because we have a very strong local health department system where we all have partners, we know one another very well, and we can put things together very quickly when we need to. So.
No, that's fantastic. But you don't do the testing yourself. That's correct, right? You don't do the testing.
Yeah, you asked me that question. I got talking about other things. No, we do not do testing here at the health department. And I think maybe earlier on there was a story maybe in the papers that talked about health department testing, and that actually meant the state health department. The state health department does have a lab, and we do have the ability to connect up with them to get tests down to them, but we do not do testing at this point here at the health department. So, and testing is something I know people are very anxious about. They want to know. Folks who are ill want to know, is it COVID, is it not? And because our testing is so limited, we're saying if you are ill, assume that you have the illness, assume that you have COVID, and stay away from one another, stay isolated in your home. You won't show up necessarily as a case in our case numbers for our county, but we know that we have hundreds of people throughout our communities who have had the illness, who have recovered and are fine. But we just don't have the testing capability right now to be able to test everybody that we want to. Yeah.
Well, I've also heard that I believe Dr. Acton was talking about having some type of testing to see if you've already had it, you know, kind of a blood test, a little prick on your finger kind of thing. Now, would you be administering that particular test, or would that be something like pharmacies? I know pharmacies, I think, here in Ohio have been given the green light to do testing as well. And I was just wondering if that would be something that they would do, that's something that you guys would do for numbers.
Yeah, well, when it becomes available, I think we're going to want to put in a system that's it's easy for people to have. It's called serology testing, and we want that because that'll give us a great idea of exactly what our community spread has already been, and it'll actually help us try to determine what might be happening in the fall and, you know, throughout the summer and into the fall. So it's an important component to us to know who all has been ill, because there are people that we know have been asymptomatic who have actually had the illness. So we may be doing that through our health centers. It's very possible. I know they've been talking with our health center side of our shop about that type of testing. But the plan for that, honestly, is probably going to depend statewide upon what the resource is.
Gotcha. Now, how many health?
But that's certainly much easier. That's a fingerprint.
I'm sorry. Go ahead.
Sorry.
What'd you say?
Go ahead. No, go ahead. I just said that's a simpler test. The RNA testing right now that we've been doing, not us, but the hospitals have been doing, is that swab, you know, and so that's a more invasive process. The original swabbing protocol, that nasopharyngeal, I know if you've seen the videos, you know what I mean. And then they've gone to just the nasal swab, and they're thinking that's just as effective perhaps as with some testing. So I know they've made those adjustments, and that's a different type of testing than the serology testing, which is more the finger prick, like you would check your blood sugars. So.
Well, and I mean, at some point we've got to get to herd immunity, right? Where majority have had it and have recovered and won't get it again. Well, at least we hope we won't get it again. Versus, you know, the future people to get it, right? So hopefully, you know, some other things of nature will be kicking in outside of testing and outside of the vaccine. I know we're going to be in this for a while. How are you kind of looking forward into the fall at this point?
Yeah. Well, I know everybody wants to know right now what's happening on May 2nd. Ohio has done an amazing job with staying home and really limiting ourselves to just doing things that are essential. And the question is, you know, the big question is what happens? How do we lessen that stay-at-home order through the summer? What's that going to look like? And then what's that going to look like in the fall again? I know people are really looking, this is not influenza, but they are looking at what happened in 1918 with influenza, how we had that spike and then it died down in the summertime and then the spike came back even bigger in the fall. They're rapidly looking at this, trying to figure out everything we can about this virus, how it affects our bodies, what it does, like lasting effects, things like that. Do you have lifelong immunity once you've had it? Right. We don't know that for sure yet. So I think all of those things are that scientific pressure, the things that they're doing right now very quickly, pulling every resource. And this is a worldwide question that everybody needs to have answered because we're all trying to figure out the best ways that we can protect our own citizens in our jurisdiction. So.
Well, exactly, and that's the key to it. Is it's not the regular flu. This is not, you know, a regular flu doesn't shut down the entire world's economy. The entire world does not stay home over just a regular flu. This is a very serious thing, and we desperately need to take it seriously for sure.
We do, and people have.
Yeah, and good, right? I am so happy that people, especially in our community here in Medina County, are really, I believe, taking mostly of it seriously and putting into place those things, that, you know, wearing the gloves, putting a mask on that so many wonderful people in the community have stepped up to make, right? Not everybody can sew.
Yes, they have. I know. That's right, but you know, everybody with that skill, and I know we put on our own website the video. If you don't know how to sew, how to use a household clothing item and use some rubber bands. So we're trying to help those folks who maybe haven't picked up that needle and thread from home ec from a while ago, and trying to help them protect themselves. But yeah, just the community has really come together, and I just have to say, this has really hurt our economy. It really, I say this every time I talk about this. There's a component about life and preserving life and our health and well-being, and our not putting our medical professionals in that horrible situation of having to decide who does and doesn't get treatment. That flattening of the curve we keep talking about, but I do recognize that it does come at a price, and it comes at a price of what's happening with our businesses. And I know people are frustrated with unemployment and things like that. And I know the state is working very hard to put things into place to try to help get people back out of where we are right now, and not to damage our small businesses. But I know how much everyone's been doing to support though everyone in our community to try to help them get through this. So it's really brought out the best in people, hasn't it?
Yes, it has. It really has. Here in Wadsworth, we've kind of rallied around our small businesses and the restaurants and trying to buy as much takeout as you possibly can, and those kinds of things, and trying to support those communities. And I was speaking with Janie Parrish earlier today. She's our executive director for the Wadsworth Chamber.
Right.
And we were talking about our graying hairlines, and she made a great suggestion about, paying it forward, because go ahead and pay for, if you can, pay for your hair now for future appointments. And I thought that was, that's a great idea. Now, right? Isn't that
Are places letting you do that? Yeah.
Why not, right? I mean, it's kind of like buying a gift card, right? Kind of thing, where you're giving them a little cash to hopefully, get through the real rough spots. But it's also very important on a health standard and health aspects not to completely open everything up so quickly all at once. And so I'm curious to see, the governor or the Speaker of the House has put together an economic group of legislators, so they're looking to how everything's going to roll back out again. And I just want to make sure that we're safe as we're doing it, because if we don't have our health, we don't really have an economy. And so and the problems with the unemployment and things like that, we desperately need to get fixed. But our health has to be first and foremost. Thank you for everything.
And I know
thank you for everything.
Absolutely, Donna. We're happy. This is why we're here. And as busy as it is, it seems kind of surreal, I know, for you guys to hear me in this quiet room, but usually several times a day, this room is full of activity of different things happening. But we have people, we're also following the orders, and we have people spread out throughout our building, and people working at home who are remoting in to help with the emergency response. So I would have loved to have taken you on kind of a backstage tour with my phone. I was just a little nervous. We have a lot going on today, and I didn't want to catch anybody talking on the phone or saying something about something that's sensitive while we walk through. But hopefully I can send you maybe some still photos or some things that you can share, because the nurses, the sanitarians, our clerks, our dietitians, it's all hands on deck here, and absolutely everybody is working very hard for Medina County residents.
Well, thank you again. I appreciate it. And please let everyone know that we appreciate them as well. And please stay safe out there.
I will. I'll share that.
And thank you very much.
Thank you.
And we'll talk to you soon.
Okay, we'll talk soon, Donna. Thank you. Bye.
Bye-bye.